You're very welcome back. Now, Harvey Morrison Sherratt was a 9-year-old boy who passed away in July after waiting more than 3 years for surgery for his scoliosis.
Since then, his parents have been campaigning for a public tribunal of inquiry into the care of all children with scoliosis and spina bifida. And Harvey's mother, Gillian, joins us now. Gillian, first of all, we're so sorry for your loss.
Thank you.
Because this was just in July, you lost your baby boy.
Yeah, just a little over 3 months ago now. And it was very sudden as well. He'd only got sick a couple of days before he passed, so it was all very, very quick.
So you weren't prepared, you weren't ready, because we've been talking about Harvey and his place on a waiting list for years. So we were just talking about this. Harvey's your little boy.
Yeah.
What was he like?
Oh, Harvey, he was such an easygoing child. He looked for nothing. He loved to go fast in his wheelchair. He loved anything sensory. Like, he loved a wet and windy day, like the weather, the way it's been the last few days, he would have loved. No, he was loved by anyone that knew him. He was just a joy to be around.
He, of course, had spina bifida, scoliosis. From what age did you become aware of his conditions?
I actually found out at the 12-week scan. It was my dating scan. So fair play to the one in the Coombe. She was fantastic to pick it up because they're tiny at that stage. And it was kind of, we knew about the spina bifida at that point, and then it was kind of, as the pregnancy progressed, they were able to identify things, obviously, as he got bigger. The scoliosis we knew was there before he was born. But it was one of those things, we were first-time parents, we'd no experience of this, so we didn't really know what that would mean for his future or how concerned we really needed to be. But yeah, so we knew very early on.
So what were the processes there? Because obviously curvature of the spine and everything that happens, it can be different for all children and all babies. So what were you looking at? What were you giving a prognosis, or it was, we'll just see what happens?
It was kind of a bit of both. We didn't find out until Harvey was just over a year how serious his scoliosis was. Up until that point, he'd been linked to an orthopaedic surgeon that only looks at feet. So we didn't actually, because no one had brought it up, we just assumed it wasn't a cause for concern. And it was only when a new surgeon came to Temple Street that he sat me down and he said controlling it was a matter of life and death, and that his ribs were already starting to crush his lungs. But at that stage, you can't do surgery on a 1-year-old, and especially Harvey was small for one. So it was kind of a watch and wait to kind of make sure it didn't get too bad too quickly, and while allowing for him to grow bigger so that they could hopefully safely do surgery.
When did you start to question that the care for Harvey had began to slip?
I think it was at that point because, like, I felt completely blindsided by that information. You know, we had this, what we thought was a thriving 1-year-old, although disabled, he was doing very well. And I think that was the moment where I realised that they hadn't been providing the care that he needed up until that point. And it was actually at that point I lodged my first complaint early 2017. Back then it was the HSE Year Service Year Say, and I lodged a complaint over the lack of orthopaedic care he'd had up until that point.
Okay. Yeah. He's a year old. Harvey went on the waiting list when he was at, was it 75%?
75 degrees, yeah.
75 degrees. Now, we've got to remember, in degrees, we're talking about actually 180 degrees, right?
Yeah.
What age was he at 75 degrees?
Oh, I don't know the maths. It was February 2022 that he joined the wait list.
So about 7.
I think 6 or 7.
Six, 75. He was 130?
By the time he had surgery, yeah.
130 degrees. So in that time, I think people need to realise everything is being... He must be finding it really hard to breathe.
Oh, yeah.
Everything's squashed.
Yeah, constantly in and out of hospital. In the later part of 2023, between October and Christmas Day, he went into hospital 5 times, multiple times by ambulance. And at that point, he hadn't even had a scoliosis reviewed in, I'd say, nearly a year at that point, because his surgeon had gone on voluntary leave. So he hadn't been reassigned a consultant. So we had to really fight to get someone to come and actually even look at him.
When did you become aware then that the operation that we hear is so vital to save these children, that Harvey wasn't going to get this operation?
And there wasn't really a point where they said that he wouldn't get it. There was always kind of reasons why. Like there was a query from one surgeon around different aspects of Harvey's health, but the specialists in those areas said, no, he's fine. And we had another surgeon say, although, yeah, he's slightly more complicated and there'd be slightly higher risks, that it wasn't kind of a contraindication. Surgery should still happen. It was just a fact that the surgeon that he got assigned didn't think surgery was the option for Harvey.
So this is something that we've known Harvey's name for a very long time, and we know that there's other children involved now, because the last 2 Sundays, the big splash on the Sunday Times by John Mooney has been about Harvey and 5 other children in particular. But what we've had is the 2 conflicting reports as to why Harvey was taken off the list. This is what people like us have been talking about your baby for the last week. So one report is based on a protected disclosure from a CHI whistleblower who alleges that Harvey was categorised as a palliative care patient. That's what we had last Sunday. And now, yesterday, John Mooney was writing about an internal draft report from the HSE that tells a completely different story, that Harvey was removed due to an administrative error during the consult transfer. And when I say that the draft says him being for surgery listed, suspended, relisted, recategorised, removed, reinstated, reassigned and removed again.
Yeah.
I'm reading that. I didn't know Harvey. That's your baby. What has been going through your head as all of these things have emerged?
I think in particular in relation to that one, that kind of shows how dysfunctional their wait list is. It shows that there's a lot of children being moved from list to list to list. And it's concerning that it could have simply been an error, because it could happen to any child that's on that list if it was just an error. The draft report, though, that I got from the HSE, that was the one that Bernard Gloucester got from CHI, there's a lot of errors in it. There's a huge chunk of his healthcare missing. Like we've actually told them it's toilet paper. That's how little we think of the MDT report we were provided. And it still doesn't actually answer the question.
You talk a lot about Harvey being just one child in this dysfunctional system. How difficult is it as a parent to see these reports, but when you're actually in it, be completely kept in the dark of what's going on with your own child?
I think it's horrible. Like, there's a huge amount of information being withheld from these parents, and like you said, like, these are our babies, and like nobody wants to see children failed in this manner. Like, this is years of systemic neglect of these children. And it's just so disheartening that the very organisation that is supposed to be caring for them are withholding vital information in relation to our children's healthcare. And I think as parents, we are entitled to know everything about their healthcare so that we can make the best decisions for them.
And is there no one to talk, like, do you feel you're just shouting into the void when trying to ask questions about what is going on?
Oh yeah, you're absolutely stonewalled. Like, when I found out that Harvey had been removed from the surgery list, I sent 5 emails to the head of the spinal task force asking what happened, and he never answered the question.
Right. More reports. Multiple internal reviews describe the spinal service and related departments as riven by interpersonal conflict with communication breakdowns and a culture in which staff felt unsafe in raising concerns about what was going on with patient care. These have had fatal consequences. Last week, in September, you had a protest. Hundreds of people turned out for yourself and Stephen for Harvey with this. Now, you met Minister Jennifer Carroll McNeill and on Taoiseach Simon Harris. How was that meeting?
It was very emotive. Obviously, there's a lot on the line with this because there are so many children that are either currently in the system that need help now and into the future. We also have a large number of children that have been failed in the past that deserve answers and accountability for the way they've been treated. And it was good that we got at least the agreement in principle to the Tribunal of Inquiry. But it was definitely hard fought for. But I do think that they realised they should have listened sooner. That was at least my feeling from it, is that they regret that they didn't act sooner.
The Taoiseach says he has launched a statutory public inquiry into scoliosis, spina bifida care at CHI, but the inquiry isn't obviously just about Harvey. This is about all children in care of scoliosis going back for years. In terms of for the government, what do you believe they need to do now?
With regards to the inquiry, or
Well, in terms of
Act.
just acting, yeah.
Oh, well, personally, I think, you know, there's the audit currently into the spinal waitlist, and I think if it's as damning as we're expecting it to be, they should be classing this as a national emergency. They should be, if they need to, they should be getting military transport for these children if they are safe to travel, to transport them to a hospital that has the capacity right now. They need to bring specialists into the country that can operate. And I also think that they should be looking at ring fencing some parts of the private hospital sector for the non-complex cases that can have surgery. Like the complex case, like Harvey wouldn't have been able to because he needed an ICU bed and ICU support and things after. But the non-complex kids could be done in the private hospital to clear up the public system for the complex kids that need an MDT around them. And I don't think cost should be any aspect of that. I think it should be more focus on the human cost of not doing anything than the financial cost of acting now.
We know the waiting list is huge, over 200 children. They're trying to get to that. And there's this tribunal inquiry, and there's 6 children that are being spoken about in particular about what's happened with them. How are you and Stephen and Remy, your baby, like how are ye doing?
I actually don't know, to be honest. Like, I don't know. I think we're very much, I'd say we've put on tunnel vision and we're focused on this. I do think it helps advocating and fighting for this because it gives us a purpose, and we're doing it in Harvey's name and in Harvey's honour. I don't think we've allowed ourselves even go there yet. It was only the other day that Stephen went into Harvey's room for the first time. And that was the day we got the inquiry secured. He hadn't set foot in Harvey's room up until that point. And I think Christmas is coming, and then Harvey's a January baby. So it's going to be a tough few weeks, but look, we're doing it in his name, and we're just hoping that we can enact true change and leave a legacy for him.
You're absolutely doing that. Gillian, thank you so much.
No,
for coming in to talk
thank
to
you.
us.
Thank you so much, Gillian.
No
I really do
problem.
appreciate it. Thanks so much.
Thank you.